Thank you. The next witness is appearing online rather than in person. Good afternoon from Geneva. Thank you very much for joining us today. Could I ask that you introduce yourself and tell us a little bit about your background? I'm sorry, I should have said first, I'm Chris Sidoti, and I'm one of the commissioners on the Commission of Inquiry. So, could you please introduce yourself and your background? There are 3 questions only that we would appreciate you addressing in your comments. First, and these all relate to the destruction of the Al Basma clinic. First, what is the short-term impact on women and men who lost reproductive material such as eggs, sperm or embryos in the attack on the IVF Al Basma clinic? Second, I know that you're an IVF expert. As such, what do you think would be the psychological impact of this incident on fertility patients? And third, what do you consider to be the long-term impact of such an incident on Palestinian people in Gaza as a group? So if you would like to introduce yourselves and address those 3 questions, we'd be very pleased to hear from you.
Certainly. Thank you, Mr. Sidoti. So my name is Lisa Farah Eways, and I'm a physician who's board certified in both obstetrics and gynecology, as well as reproductive endocrinology and infertility. I've been in the field of reproductive medicine for over 25 years, and I'm currently serving as the IVF program director of my program. So to address your first question of what is the short-term impact on the men and women in Palestine after the attack on the Al Basma IVF clinic. As a result of the attack on the Al Basma IVF Center in December of 2023, over 4,000 frozen embryos and 1,000 frozen eggs and sperm were lost. In order to understand the magnitude of the loss of these reproductive tissues, I think it's important for us to understand why patients go to IVF treatment and the process of IVF. The most common reason that patients undergo IVF, of course, is that they have infertility. A patient may have been trying to conceive with their partner for a period of several months or even years. There was no success in trying to get pregnant on her own. She may have sought treatment. She may have done conservative treatment first, and the conservative treatment may have failed. Therefore, she decided to proceed with aggressive treatment, such as in vitro fertilization. So primarily infertility is the #1 reason. However, many couples do not have infertility. They have a genetic condition that they both carry. They're unaffected. But if they were to have a child, their child would have a 25% chance or higher of having a congenital birth defect, which sometimes can be lethal. They can undergo in vitro fertilization with a special test called pre-implantation genetic testing so that they can try to select a healthy child for transfer so that they can have a child free of disease. A third reason that somebody may pursue in vitro fertilization could be that they were diagnosed with cancer and they're going to undergo a treatment such as chemotherapy or radiation treatment, and that treatment will render them infertile. If that patient has a partner, she can choose to freeze embryos. If she doesn't have a partner, she can freeze eggs, and of course, men can freeze sperm. Oftentimes, IVF is diminished into a 3-letter acronym, but the process is very complex, and I think that 3-letter acronym undermines the process. So I want to give the audience a little bit of information about what IVF entails. For the female patient, IVF entails daily hormone injections for 2 to 3 weeks, during which time the patient is monitored with ultrasounds and blood tests to monitor her response to the hormonal medications. When the time is right, the patient can undergo an egg retrieval under anesthesia to have her eggs removed. This is done through a surgical procedure. If family building is her goal, the eggs are fertilized with her partner's sperm, and the embryos are cultured in the IVF lab over several days. Not frequently, but sometimes embryos can be transferred in that fresh cycle or at the same time that her eggs were retrieved, but oftentimes the eggs are frozen as embryos for future use. If a fresh transfer is performed, the excess embryos are monitored for development. And if they make a good quality embryo, they're frozen. If that fresh embryo transfer is not successful, the patient can then use those frozen embryos rather than going through the whole egg retrieval process to try to have a child with a frozen embryo transfer. If the patient is successful, those frozen embryos can be used for her to have a future child. If a patient is in need of IVF with pre-implantation genetic testing, none of the embryos are transferred in that cycle. The embryos are cultured until the blastocyst stage, day 5, 6, or 7 of development. They're biopsied when they're good quality and then frozen, but we can only biopsy good quality embryos. We can't use all of the embryos that are created. After the biopsy is performed, the biopsies are analyzed at an outside IVF genetic center, and then the fertility specialist can help the couple choose healthy, unaffected embryos for transfer. If a patient's diagnosed with cancer, her embryos, if she has a partner, are frozen for future use. If she doesn't have a partner, she can freeze eggs. And of course, men with cancer who are going to undergo a therapy that will cause infertility can have sperm frozen for future use. In addition, males with infertility can sometimes require a sperm extraction that's needed prior to an IVF cycle, so that sperm can be used for that current IVF cycle, and hopefully there's enough sperm to use for future cycles. I think it's also important to understand how and why the embryos are frozen. Embryos, eggs, and sperm. Embryos, eggs, and sperm are frozen so that they're frozen in time and development. They must be frozen in special solutions and then stored at a temperature of negative 196 degrees Celsius in liquid nitrogen. If that level of liquid nitrogen in the storage tank is not kept at an adequate level, the embryos, eggs, and sperm can be destroyed. Following October 7th, 2023, I understand that by mid-November 2023, the Albesma IVF Center was having difficulty getting liquid nitrogen to keep their tanks with adequate levels of liquid nitrogen to keep their embryos, eggs, and sperm frozen. Each one of their tanks could store 2,000 to 2,500 embryos, eggs, and sperm, reproductive tissue specimens. Because they were running critically low on liquid nitrogen, they had to make a difficult decision at that time to compact 3,000 specimens into a tank that normally holds 2,000 to 2,500 specimens. And they had to sacrifice 2,000 specimens early on in November 2023. So there were already 2,000 specimens lost at that time, unfortunately. So as you can see, the short-term impact to patients, both male and female, of these reproductive tissues being lost is profound. For female patients and even male patients, rarely, there's time lost against the biological clock. Many patients try to conceive for several months or years prior to seeking a consultation with a fertility physician. This delay in treatment could be due to financial constraints, difficulty accepting a diagnosis of infertility, difficulty in access to care. And once patients pursue treatment or seek a consultation, it can take months to have a consultation. Once a consultation is performed, it can take several months, 2 to 3, to start treatment. And once treatment is started, it can take 2 to 3 months to actually proceed with an embryo transfer if a fresh embryo transfer is not performed. For patients with cancer, these tissues were their ability to consider a future for having children. They have had to prematurely consider their fertility. And their reproductive tissues may have been their only samples that would have given them any hope of having a child. According to Dr. Bahaldeen Galayini, who is the Cambridge-trained OBGYN who established the IVF Center in 1997, he said that many families become indebted to family or friends in order to be able to pursue in vitro fertilization. They sell heirloom jewelry, household goods, or other valuable items to proceed with IVF, which can cost them anywhere from $2,000 to $2,500 per attempt. The patients may not have the resources to undergo another cycle, especially given the ongoing hardships in Gaza over the last 18 months, as well as the fact that the average household income in Gaza prior to October 7th, 2023, was only $13 a day. To put the cost of IVF into perspective, if an individual in Gaza works 5 days a week, 50 weeks a year, one cycle of IVF would amount to 3/4 of their wages. This wage information was obtained from the 2022 Investment Climate Statements on the West Bank and Gaza that was written by the U.S. Department of State. Therefore, as you can see, for those who sacrificed everything to fund their IVF treatment, the loss of these specimens is devastating. Physically, many of the patients have already endured hormonal treatments, invasive procedures, and the side effects that accompany them. It's not uncommon for patients to have to undergo more than one cycle of IVF. However, for many patients in Gaza, this may no longer be an option. There may not be a possibility for them to retrieve more eggs or sperm due to advancing age, health conditions, or medical treatments like chemotherapy or radiation that may have compromised their fertility permanently. Thank you. So to go on to the second question, what would be the psychological impact of the attack on the IVF center? The psychological impact of a loss of this reproductive material is very significant. In general, patients with infertility experience anxiety and depression. They also experience post-traumatic stress disorder after infertility or with reproductive loss. Imagine what's going on in Gaza right now. So if patients in general in a well-supported society with mental health and social support have PTSD, patients in Gaza currently have a much harder time because they have societal trauma that's occurring around them, leaving them with a lack of resources to give them mental health and social support. This can cause them social isolation, strain their personal relationships, and it can diminish their mental health, especially with individuals who are already facing such immense trauma. The compounded stress of personal loss amidst widespread community devastation deepens these emotional scars and leaves many without the support systems that they so desperately need. It's a basic human desire to want to have a family. For these patients, IVF was more than a medical procedure. It was a lifeline to a future they had envisioned, one that has now been stripped away from them. The loss of embryos or reproductive material is often experienced as the loss of a potential child and carries with it the same depth of grief. It's also important to realize that there's repercussions for the medical team caring for these patients. The physicians, the embryologists, the nurses, the counselors, we all dedicate our lives to helping patients conceive on a daily basis. It is estimated that for each IVF cycle, there are 9 to 20 personnel hours that are involved in one cycle, depending on the complexity of the cycle. So you can imagine that we've bonded with our patients and we're dedicated to them, and they're like family to us. For us and for them, those in Gaza, the psychological impact can include professional guilt and trauma. There may be a sense of personal failure or helplessness, despite knowing that the event was beyond their control. As far as the long-term impact on the patients, the Palestinian population in Gaza, according to Dr. Galliani, over half of the couples with reproductive tissues stored at the clinic can no longer produce viable eggs or sperm to make embryos to help them conceive, and that was their only chance to get pregnant. The loss of these tissues can be seen as a direct violation of the patient's reproductive rights. Each of those 5,000 reproductive tissues represented someone's hopes or dreams for a family. And the loss of these tissues represents a loss of their reproductive autonomy. Patients who view their embryos as potential lives may struggle with deep existential and moral dilemmas. For many patients, the emotional toll can manifest as grief and mourning, similar to that of the loss of a child or a miscarriage. There are many infertility patients who have to undergo several cycles of IVF in order to obtain the number of embryos that they need to get their desired family size. But in other cases, patients don't have any viable embryos from their first or second cycle of IVF. Therefore, these reproductive tissues could have represented a patient's first, second, or third, sometimes fourth or fifth cycle of IVF. Even for those who can afford to do IVF again, the road forward is uncertain. The emotional toll of starting over, the physical burden of undergoing another cycle of injections, the hormonal side effects, and the financial costs create immense barriers. This attack will therefore have repercussions for generations to come. Children who were meant to be born from these 5,000 reproductive specimens will never exist. Families will be forever changed, and bloodlines may end because of a loss of these reproductive tissues. Patients seek fertility care in a place of safety, trusting that their embryos will be safeguarded. Their trust has now been shattered, raising fears about the security of medical and reproductive care in Gaza. As medical facilities in Gaza, places that exist to create and sustain life, continue to be targets, it makes it all the more challenging for individuals to access care and to be able to mobilize the resources that they need to pursue these services. In this setting, the long-term consequences for global healthcare and human rights are truly not measurable. From a human rights standpoint, the loss of these reproductive specimens, these tissues, undermine fundamental rights such as access to medical care, reproductive autonomy, and reproductive freedom. Thank you.
Thank you very much for your comments. They are very much appreciated. We need the expertise that you can bring to our deliberations to help us to understand the impact. We appreciate very much the time that you have given us today, and particularly your willingness to offer us your expertise to understand this attack. So thank you very much.
Thank you very much for having me. It's an honor.